Hey guys, so today we are going to break down the the Milady Standard Aesthetics textbook, chapter 13, Advanced Topics and Treatments. So, if you are in aesthetic school, currently taking aesthetics courses, or just simply want to refresh yourself, this video is going to help you understand everything in this chapter, from chemical peels to microdermabrasion to LED light therapy and many others. There are 13 objectives from this chapter. I'm going to slide past these 13 objectives. You can see them on the screen. There's no need for me to break each and every one of them down, but essentially these are all of the things that we're going to cover in chapter 13. So we're going to start with explaining advanced skincare topics and treatments for licensed trained estheticians. So understanding the foundations of the equipment, indications, and contraindications will enable you to employ combination therapies that will yield greater results and client satisfaction. Advanced treatments have expanded the esthetician's repertoire to include more results-driven treatments such as chemical exfoliation, microdermabrasion, microcurrent, ultrasound, and LED treatments, which stands for light emitting diode. In terms of why we should study these advanced treatments, for one, you always want to stay on top of any new development in machine technology or new development in general when it comes to skincare and beauty. You also want to stay competitive, and it's simply a part of your professionalism. So let's hop right into describing chemical exfoliation and chemical peels. There are three different methods of chemical exfoliation. We have mechanical, manual, and chemical. So, you, excuse me, you may ask, what is chemical exfoliation? In the field of skincare, we define the process of removing excess accumulations of dead skin cells from the corneum layers of the epidermis as superficial peeling, exfoliation, keratolysis, and desquamation. These are interchangeable terms, so I'll say them again. Superficial peeling, exfoliation, keratolysis, and desquamation are all terms that we use to describe the process of removing excess accumulations of dead skin cells from the corneum. In terms of the different methods that we use, for example, mechanical exfoliation would be considered microdermabrasion. That would be one example of mechanical exfoliation because you'd be using a machine, vacuum, some sort of suction, and diamond or crystal tips in order to perform your microdermabrasion. So microdermabrasion is a mechanical form of exfoliation. We also have manual forms of exfoliation, which are like our scrubs. So sugar scrubs, salt scrubs, jojoba beads inside of a sugar or salt scrub. Okay, those would be considered to be manual exfoliation. And then in terms of chemical exfoliation, that would be by use of specific products, things like enzymes, alpha hydroxy acids, beta hydroxy acids, light Jessners, and light trichloroacidic acid peels, which trichloroacidic acid stands for TCA. And all of these are formulated to achieve results of exfoliation on the skin. Theory does tell us that advanced training and certifications are necessary to perform exfoliation treatments and peels. So, again, if you have not had the proper training, please invest in a class, save yourself and save your clients, and understand what you're doing when we are performing chemical peels. At Beauty Culture Academy, all of our students learn chemical peels, the ins and outs. They learn the pH scale and If they learn the contraindications of peels and also the indications for chemical peels. If you are knowledgeable and are trained, then you can provide significant results to your clients by use of these various these various products. One thing about our chemical peels and chemical exfoliations is that they will yield more significant results, help produce a clinical change in the skin, and are commonly used to address things like photoaging, acne, and hyperpigmentation, amongst other skin conditions and concerns that your clients may have. Your state's regulatory agency will determine the guidelines regarding the strength and the pH of products that you can use. So make sure that as a licensed esthetician, you are always working within the scope of your license. So let's break down acid, alkaline, and pH relationships. To understand the strengths of peels and the different formulations, it is important to understand acid, alkaline, and pH relationships. pH is especially important consideration in the peel process. You definitely want to know the pH scale and know how you want to know where your peels fall on the pH scale, and you also want to know what to do in order to neutralize your chemical peels. Acids have a pH of 0 to 6, neutral is 7, alkalines range from 8 to 14 on the pH scale. The average pH of skin is 5 on the pH scale. Acids penetrate the skin and can be a cause of irritation because of their small molecular size. A pH of less than 3 is not recommended for salon peels, and most states do not allow use of a lower pH. So again, a pH of less than 3 is not recommended for salon peels, and most states do not allow the use of a lower pH if you are only an esthetician. Buffering agents are ingredients added to the products to help make them less irritating. Products with a higher acid percentage and a lower pH are more irritating. The acid needs to have a pH lower than the skin's pH to be effective. So if you take a look at the pH scale, you can see that the hair and skin falls at a 5 on the pH scale. So in order for chemical peels to be effective, chemical peels have to be a lower pH than the skin's pH in order to be effective. So again, most of the chemical peels that you will have access to as an esthetician is at about a 3 on the pH scale. So let's put some of this into perspective. A spa level of 30% concentration of glycolic acid is usually formulated to have a pH of 3 if it is buffered properly. When we say buffer, remember that just means that there have been added ingredients to make the peels less irritating. Physician peels have a higher percentage concentration and a lower pH. Over-the-counter alpha hydroxy acid home care product formulations usually contain about 2 to 5% acid, and alpha hydroxy acid home care product formulations sold by spas range from anywhere from 5 to 10%, and physicians carry home care products with higher percentages of acids. So essentially, we need to consider two things when we are performing chemical peels. We need to consider their actual pH and the actual percentage of the acid. The higher the percentage, the stronger the peel is going to be. Also, the lower the number, the stronger the peel is going to be as well. And when I say lower the number, I'm talking about the lower the number on the pH scale. So again, in the range of an esthetician scope, Most of the pills that you're going to use are going to have a pH of around 3 to be within your scope. Peels are sometimes used to restore a skin's natural glow, which can be inhibited by hyperkeratinized skin and skin that is not functionally optimally at the physiological level. The cell renewal factor, or we call it the CRF, or we can also call it the cell turnover rate, is the rate of cell mitosis and migration from the dermis to the top of the epidermis. This process slows down with age. The average rate of cell turnover for babies is about 14 days. So basically, it takes a baby about 2 weeks to generate new skin cells from the lower level of the dermis all the way to the top layer of the epidermis. So it takes 14 days for baby skin cells to develop in the dermis and reach the epidermis as they're ready to shed off. So if we take that into perspective for teenagers, that process takes about 21 to 28 days. For adults, that process takes about 28 to 42 days. And for those who are 50 and older, it takes about 42 to 84 days. So the actual goal is to keep cell mitosis going. That is the main goal of skin preservation. So we do need things like chemical peels to help us preserve our cells, or if we're not going to use chemical peels, everyone needs some form of exfoliation in order to preserve their skin. So next up we have light, medium, and deep peels. I am turning to page 644 to see if there's anything interesting that I need to make sure that I cover, and everything here is important, so I'm going to take a little bit of time here. So there are 3 levels to our skin peels: superficial, medium, and deep peels. Superficial peeling removes cells from only the stratum corneum. Superficial or light peels are esthetician administered and generally include enzymes, glycolic acid of 30% or less, because we have to work in our scope, lactic acid of 30% or less, and in some cases, Jessner solutions and low percentages of TCA. And when I mean low percentages of TCA, that is a peel that we usually apply in layers. So meaning 1 to 3 layers of a TCA peel. The term chemical exfoliation is sometimes used in the place of the word peel to differentiate the difference between medium and deeper clinical peels and the lighter chemical exfoliation used in spas. Physicians use a high strength peel formulation that are designed to penetrate deeper into the skin, basically down towards the dermal layer. These peels are commonly referred to as medium or deep peels. Peels administered by physicians make use of the following chemicals: resorcinol, which is a brightening agent; phenol, which I like to tell my students is a form of alcohol; trichloroacetic acid, which we commonly call TCA in the world of aesthetics; glycolic acid at 50% or more; Jessner's peels at 4 to 10 layers, which is an extreme amount of layers. And the Jessner's peels also contain lactic acid, salicylic acid, and resorcinol in an ethanol solvent. So basically an alcohol or ethanol based product. Okay. They also, physicians will administer TCA peels at a medium depth that removes the epidermis down to the dermis. Definitely have to have a doctor's license for that, or a physician's license for that. And lastly, phenol, which is a highly acidic deep peel that peels down into the dermis. This peel is not commonly used, but it is still important to be aware of it. So Medium depth peels are performed primarily with stronger TCA concentrations by physicians to remove the entire epidermis and part of the papillary dermis. Although not used often, deep peels are performed primarily with a phenol solution by physicians to peel deep within the dermis. There has there has been a movement towards the use of ablative lasers versus deep peeling solutions due to the ability to control the depth of procedures with the former measures. With lasers, you can limit the number of passes, but peel solutions may penetrate beyond the desired depth, so that's something to consider and think about. And just to recap, as you can see, our superficial peels, which are within the scope of an esthetician, should not go past the the epidermis. All right, should not go past that basal cell layer. We have medium depth peels that will penetrate through the epidermis and also get down to the dermis layer below that basal cell layer. And then we have deep peels. Both medium and deep peels are going to be performed by physician, and they do penetrate through the epidermis, past and beyond the basal cell down to the dermis. In terms of effects and precautions for chemical peel, so a few effects and precautions include for peels and chemical exfoliation results. We want to use these to improve the texture of the skin. Your client may want to, or you may need to, improve your client's barrier function or promote moisture retention. Like we also discussed, cell renewal factor, hydration, intercellular lipids are going to also be a result of using chemical peels. So we can use these to boost and speed up cell turnover, promote hydration, and intercellular lipids within the skin. We can also use these peels to reduce fine lines, wrinkles, and surface pigmentation. We can also reveal skin that looks and feels smoother and softer, improve skin conditions such as acne, hyperpigmentation, clogged pores, as well as dry skin, and potential stimulation of elastin and collagen. So just know that there are a bunch of different things that you may use a chemical peel for in your practice. The biggest thing is knowing which one to use and why you are using it and how to effectively apply the chemical peel and treat your client with the peel, as well as give them the proper aftercare instructions for their peel. In terms of general contraindications for chemical peels and chemical exfoliation, exfoliated skin needs to be protected from sun exposure and tanning to avoid hyperpigmentation and damage to the skin. Sunscreen must be used daily when using any alpha hydroxy acid or any other strong exfoliating products or treatments. But let's just tell everyone you need SPF on a daily, and especially if you are receiving treatments such as chemical peels and chemical exfoliation. Um, Chemical exfoliation and peels can result in burns that may require medical attention and can scar your client. So, again, it's very important for you to understand what you're doing, understand the types of chemical peels, understanding your client's skin and what they're seeking to improve or wanting to make changes in, and ensuring that you're able to deliver positive, successful results for your clients. Make sure that you consult with your client before applying any type of chemical exfoliation. Also, make sure that you always follow your manufacturer's instructions, and whenever possible, perform a patch test either on the inner arm, inner wrist, inner crease of the elbow, or behind the ear 24 to 48 hours before giving a treatment to watch for adverse reactions to the product. Additional chemical exfoliation contraindications include the following: If they've had recent cosmetic surgery, laser resurfacing, chemical peels, or dermabrasion, recent injectables, fillers, or Botox, using retin A, allergies or sensitivities to products or ingredients that you're going to be using with the pill, pregnancy, active herpes simplex, inflamed rosacea or acne, and I will say I want to highlight inflamed rosacea or acne. So your clients that suffer from rosacea and acne, they actually may be a good candidate for a chemical peel as long as it's not inflamed, okay? Infectious disease is also a contraindication. Any open sores or suspicious lesions in the area that you're going to be performing the peel, any sunburned skin or irritated skin, any photosensitizing medications that your client may be taking may make the skin very sensitive to sun. Chemical peels, they may make you sensitive to the sunlight, or any medications that they may be using or taking that may make them sensitive to sunlight. And lastly, any other contraindicated drug or medication. To prevent skin damage, warn your clients to avoid sun exposure, scrubs, rubbing, peeling the dead skin, any kind of depilatories, waxing, benzoyl peroxide, and exfoliating or glycolic acid products for at least 24 to 48 hours before or after any chemical exfoliation procedure. And then recommend a longer period of time if the client's condition warrants it. So always, always, always put your professional hat on, and your client's protection and safety should be number one. So I just gave you a list of contraindications for chemical peels in general. So again, retin A, pregnancy, active herpes outbreaks, tendencies for hyperpigmentation, any recent Botox injectables or fillers, any kind of infectious disease. We want to make sure that we are not performing peels on those clients or in those situations. All right, so next we're going to identify how to safely and effectively use chemical exfoliation and peels. So let's start with an enzyme. I always like to teach my students that enzymes are kind of like your gateway to chemical peels. If you have a client that's never received a chemical peel, I always recommend applying an enzyme first, letting them experience that and become used to chemical exfoliation. And then from there, as you learn your client's skin and you determine how resilient their skin may be, then you can start introducing other forms of exfoliation. So, what is an enzyme peel? It's important to identify the different types of exfoliations that are on the market today. Enzyme treatments are often referred to as enzyme peels or enzyme masks. Okay. Whereas physical exfoliants work to slough off the dead skin cells sitting on the surface, enzymes are proteolytic in nature and work to digest keratin protein. So think of your enzymes as like a Pac-Man, and it's going through and eating up all the fruit and all of the little yellow dots, which would be our dead skin cells that are on the surface. So enzymes typically are going to only eat away the dead skin cells on the surface. They are not going to penetrate the epidermal layer of the skin. Okay. Um, enzymes, enzyme treatments, depending on their composition and your client's skin, can be gentle enough to repeat once a week. So if you're wondering how often can you use enzymes, that can be a weekly thing. You may also find that some you may want to put more time in between, because some enzymes, well, some I would say, well, some manufacturers, they will boost their enzymes and add forms of chemical exfoliation into their product formulation. So some enzymes do have some active acids in them that will also work as strong as a chemical peel. So always read your manufacturer's instructions. You will find that most clinical facials include the use of an enzyme mask for an enhanced exfoliation and to assist and preparing the skin for easier extractions. Enzymes can also be combined with microdermabrasion. These may be referred to as microdermabrasion peel combination, LED, and many other enhanced treatments to prepare the skin to yield greater results or enhance exfoliation. You will find that enzyme treatments come in a couple different forms, such as masks that are already pre-made, and some come in a liquid and powder form as well that you mix just prior to application. Um, Common ingredients found in your enzymes. So, bromelain is a common ingredient found in enzymes. It derives from pineapples. If you have a client that is allergic to pineapples, then you want to stay away from any enzyme that may have a bromelain ingredient. Papain also is derived from papaya fruit. So again, if you have clients that are allergic to papaya, you may have to skip the papain enzymes. And then we also have enzymes that are made from like a meat byproducts. Those are made from pancreatine and trypsin. So those are some common ingredients that enzymes are made out of. Make sure that you know those. And again, I will say that one more time. So for your ingredients of enzymes, bromelain, papain, pancreatine, and trypsin, those are all common ingredients that are found in enzymes. You want to make sure that you are thoroughly consulting with your clients and understanding any contraindication that they may pose or have, such as an allergy. When to use enzymes. So, when determining whether a treatment is appropriate for a client, consider the following factors. You want to consider their skin type, you want to consider their sebaceous gland activity, you want to consider their skin conditions, the client's philosophy of sun exposure, their cosmetic and product use, and whether or not they're using retin A and other acids or alpha hydroxy acids or acne products or acne drugs such as tetracycline or doxycycline. Enzyme peels can be applied again once every 1 to 2 weeks. So again, that would be the time frame. These can be performed more often, and they're usually used in conjunction with a clinical facial or to prepare for an advanced treatment such as microdermabrasion, ultrasound, or LED. Enzymes are not typically used prior to a chemical peel. Okay, they are not typically used prior to a chemical peel, meaning in the same day. Typically, you're going to apply your enzymes, and that is going to be all that you would do in terms of exfoliation for your clients on that day. There are lots of different things that you may see on Instagram and TikTok. Right now, I am teaching you this based on what the theory says in the Milady Standard Cosmetology, the Milady Standard Aesthetics textbook, chapter 13. So next we're going to get into considerations for treatments and also the effects of an enzyme peel. So in terms of the enzyme peels and their effects, like I mentioned, these can be performed every 1 to 2 weeks, and you can also perform them in conjunction with other services such as microdermabrasion, LED, and ultrasound. In terms of the effects of an enzyme peel, so the results are going to be very superficial, they're going to be temporary, and they're going to provide a refreshed, dewy complexion, but none of the in-depth clinical changes such as those that are seen with an AHA, BHA, Jessner's peel, or TCA peel. Okay, because most solutions will come in the form of mask, you will be unable to see the skin's response, and you will rely on information obtained from the client to determine if the mask is processing according to expectations. There should be no reaction beyond a very light tingling, or sometimes there may even be an absence of any tingling for some of your clients when you perform enzyme peels on them. So they should not have a high tingle factor when using any of your enzymes. And just so you know, make sure that anytime that a client is saying, hey, something's burning, or if I usually always recommend that students make a habit of asking on a scale of 1 to 10, what is your tingle factor? 1 being it's not tingling at all. 10 being I am on fire. I am not going to make it. Call the fire department. So anything over like a 5 tingle factor, that should be your indicator to stop what you're doing and don't go any further. Okay. But again, with some chemical enzyme, excuse me, with some enzyme peels, you may have a tingle factor, and the tingle factor may be normal. The main thing is you don't want your clients to burn. Also, if you are applying a mask, you can see through it. Usually, with some of our enzyme masks, they may be less translucent. So again, make sure that you keep the lines of communication open. Never walk away from your client when it comes to performing any of these enzymes or chemical peels. And if you do notice signs of erythema, which is redness, or even some pinkening of the skin, that may be very normal. So do not freak out. But the main thing is understanding your products, understanding your ingredients, communicating with your clients, and following the manufacturer's instructions. But your client may experience some tingling. Their skin may look a little pink. Okay, that is an enzyme peel and what they do. All right, moving right along. So, what is, let me go back. So, I talked about the effects of the enzyme peel. Now, I need to cover the contraindications for your enzyme. So, again, remember to always follow the manufacturer's instructions. Eyewear is always recommended to protect the client and the technician. OSHA requires that anytime a corrosive agent is used, the technician must wear protective eyewear with side shields, okay? And you also want to have an eye wash station just in case you need to flush your eye out or your client's eyes. The manufacturer will provide instructions, so make sure that you always read. Guys, I cannot reiterate how important it is to read. Some of us don't like to read. We like to try to figure things out. But I promise you, if you just stop for 1 minute and read the instructions, the recommendations, and precautions on your products and your protocols, you will be a better esthetician and you will have happier clients. Also, some areas may process sooner than others, so you may need to do spot removal on those areas, okay? You can do that. You can remove some areas while you let some areas process longer. And then a rule of thumb as a new beginner, if the manufacturer's instructions tells you to process for 15 minutes, you can take off in 12 just to make sure that you are not over processing the skin and to ensure that your client will be happier with their results. Because the last thing that you want to do is leave any products or any chemicals on the skin too long and give your client a chemical burn. Okay. You also want to be prepared to always remove any peel prior to reaching the end point. Again, the end point is going to be any redness or the point of where you need to remove the product. And that's as much as I will say on that. All right, so next we have alpha hydroxy acids and beta hydroxy acid pills. So what is an AHA or BHA pill? So alpha hydroxy acids stand for AHA, and they are mild pills that come in different percentages and pH levels and help to dissolve the desmosomes between the cells to keep the skin cells exfoliated. Alpha hydroxy acids penetrate the cornea via intercellular matrix and loosen the bonds between the cells. So I like to teach my students that when we are loosening or dissolving the desmosomes, basically the desmosomes are like the glue that holds your skin cells together. So anytime we're performing an AHA, we are basically breaking that glue down with those acids. So the intercellular matrix, what does that make up? What does that consist of? So it consists of ceramides, lipids, glycoproteins, and active enzymes that we have within our skin. AHAs also stimulate the production of intercellular lipids. Glycolic acid, which is a commonly used alpha hydroxy acid, can penetrate the epidermis more effectively because it has the smallest molecular size of the AHA. So, another rule of thumb for my students, every acid on the market is going to be an alpha hydroxy acid, with the exception of salicylic acid, which is a beta hydroxy acid, and with the exception of TCA and our Jessners, which we will get to those a little bit later. Most AHA pills you will use will not be at the level that will yield any kind of peeling or flaking. So I also want to take the time to remind you and to educate you on the fact that every pill that we have is not going to make our clients peel. This is a very important thing because some people are afraid to peel. Some people may be able to benefit from a peel but may not have to have one or experience excessive shedding. And on the other hand, you're going to have clients that are not going to feel like you're doing your job or getting them results if they don't see peeling. So just pick your poison. Make sure you educate your clients so that they know the types of peels and what to expect with the peel, because not with every peel your clients are not going to peel. And just another interesting fact, most people don't know, if they're using anything over the counter that has any kind of alpha or beta hydroxy acid, guess what? They're already peeling anyway. They're just peeling at a lower level. All right, so I'll move past that. So our AHAs, they include glycolic acid. Again, that is the smallest molecular size. Glycolic acid is going to penetrate the most out of all alpha hydroxy acids. Glycolic acid is derived from sugarcane, and it is the strongest alpha hydroxy acid. Okay, alphas are the strongest. All right, so then we have lactic acid. Lactic acid is derived from milk. Tartaric acid is derived from grapes. Malic acid is derived from apples. Citric acid is derived from citrus fruit. And then mandelic acid. Mandelic acid is derived from the bitter almond. BHAs, they work under the same premise of AHAs, but they are better suited to dissolve oil and are primarily used for oily skin and acne. So, ladies and gentlemen, if you're using a beta hydroxy acid on your client and they are not oily or acneic, you are not going to get any results for them, okay? Because beta hydroxy acids, they are oil soluble. They like oil. They want to eat up the oil. They want to get rid of your acne. So, in general, you are going to use more than likely alpha hydroxy acids for things like wrinkles, hyperpigmentation, sunspots, collagen production, okay? For your beta hydroxy acids, we're going to be using them for our oily or acne clients. You will find that beta hydroxy acid pills are usually stronger than alpha hydroxy acids, and guess what? They have an even smaller molecular size than glycolic acid, okay? You may encounter some slight peeling and flaking with your beta hydroxy acid, maybe even mild peeling, depending on the strength of that beta hydroxy acid. So, again, beta hydroxy acid includes salicylic acid, which is derived from sweet birch, willow bark, and wintergreen. And beta hydroxy acids have an antiseptic and an anti-inflammatory property about them. So now that I have broken down the difference between alpha hydroxy acid and beta hydroxy acids, let's talk about when we use the both of them. So when it comes to using alpha hydroxy acids, You want to determine which peel treatment is going to be appropriate for your client. So you want to consider the skin type, you want to consider the sebaceous gland activity, skin condition, their philosophy on sun exposure, their cosmetic and other product use, and whether they're using any type of vitamin A products. Um, for your alpha hydroxy acids, you want to have a home care plan that works in tandem with your in-office clinical treatments. This is very important. It's the best way to convey their importance to your client is by emphasizing that you're providing the pill to assist the client. You're providing the pill to assist in restoring the client's skin to optimal functioning capacity, but you are not performing any at home maintenance. So neglecting the home maintenance is likely taking 2 steps forward and 1 step back. So what they do at home is going to be essential to the results that they get from your chemical peels. You also want to design a treatment plan based on a series of treatments to jumpstart your client's progress. So a series can consist of 6 to 8 peels administered once a week to 8 weeks. Once a week over 6 to 8 weeks. I'm sorry. So during the series, and also I feel like once a week may be a little bit excessive. It depends on the strength of your peels. Some of your always follow your manufacturer's instructions. Some of your peels you may have to wait 4 weeks in between. So I don't want to say I don't agree with the theory there, but always follow your manufacturer's instructions. If it tells you, if they tell you to wait 4 weeks in between, then you wait 4 weeks in between. Okay. Um, Also, in the maintenance phase, you maintain the results by administrating monthly maintenance. So once you have reached your clients' desired results with their peels, then you can drop down to performing your peels once a month or maybe every 6 weeks. Some technicians' treatment plans work on a graduated peeling system where you may start at the mildest level of peels, such as like a 2% lactic for the first couple of peels in the series, and then maybe move to a low grade glycolic acid working up to a 20% or possibly even ending at a 30%. So that's pretty much the ins and outs of when to use AHAs. And remember, your alpha hydroxy acids are going to be great for targeting hyperpigmentation, fine lines, wrinkles, sunspots, collagen, dry skin, etc. All right. So when to use BHAs is going to be the same way, meaning make sure that your clients understand the home care, understand that it is a partnership in the peels. You're going to use your beta hydroxy acid peels for your clients that are oily or that have acneic skin. You may start off with a milder, lower strength and work your way up to those higher strengths of your peels. As far as contraindications and best practices for your alpha hydroxy acids and beta hydroxy acids. So always remember, before chemical exfoliation, you need to discuss potential issues and contraindications during your client consultation. Explain the procedure, explain the expected outcomes, and give them realistic goals. In a diagnostic facial or skin analysis before scheduling your treatments, note on your client's intake form the condition of the skin, including any dehydration that they may have, any hyperpigmentation, open lesions, or any other skin condition. And then also choose the type of exfoliant based on their conditions and their desired results. Okay? So these pills and these services are not a one size fit all. You have to customize for your clients. Always keep the manufacturer's instructions. Keep in mind the manufacturer's instructions. Always follow them. Always take any precautions, meaning applying occlusive barriers around the corner of the eyes, the mouth, and the nostril area, because sometimes those areas are thin skin and they are easily irritated with chemical peels. So applying an occlusive barrier like maybe Aquaphor or Vaseline at the corner of the nostrils, around the eyes, and around the mouth will help during your chemical peel process. And then because the sun is stronger in the summertime, it's not recommended to perform chemical peels during the summer. I would recommend maybe enzyme peels or microdermabrasion for clients in the summer. And then neutralizing. Know how to neutralize. Know if your peel needs to be neutralized. Um, a big thing that a lot of estheticians fail to understand is the main ingredient in your neutralizer is baking soda. I'm going to break down and how we're going to have a separate class on the pH scale and understanding neutralizing later. But always neutralize. Never skip that step, especially if the manufacturer's protocols tell you to neutralize. Okay, so that's pretty much it. Um, with your beta hydroxy acids, there may be salicylic crystal residue present, which should not be confused as frosting that we experience sometimes with our Jessner's or TCA peels. In some cases, when a 30% BHA is used, the client may experience some frosting around thin skin areas such as under the eyes, the corner of the mouth, or even around some blemishes. So again, it's recommended to apply an occlusive barrier in those areas to prevent that. And then sometimes a Woods lamp is used with beta hydroxy application so that you can view the accuracy and the evenness of the peel application as the peel can be illuminated by the lamp. So that is your interesting fact. Okay, guys, so we have made our way to page 652 in the Milady Standard Aesthetics textbook. So now we are discussing what a Jessner's peel and what a TCA peel is, or what they are. All right, so what is a Jessner's solution? So a Jessner's peel is categorized as a stronger superficial peel and utilizes a Jessner's solution, which is a mixture, this is a test question, a mixture of salicylic acid, resorcinol, which is a brightening agent, lactic acid, and ethanol. You may also find some of these formulations contain 2% phenol. Trichloroacidic acid peels are also known as TCA peels. So Jessner's, I like to say that they are like a combination, a combo peel, and then your TCA peels is just trichloroacidic acid by itself. Your Jessner solutions are going to be great for clients that have oily or acneic skin, but also maybe be experiencing some sun damage or hyperpigmentation. So Jessner's peel or Jessner solution is actually one of the ways to go. You get your bang for your buck. You kind of get the benefits of what an alpha hydroxy acid and a beta hydroxy acid would do for a client in one bottle. Trichloroacidic acid pills, I'm going to tell you now, this is not for your melanated people. This is not, I repeat, TCA pills are not for melanin ladies, okay? Anybody that has a 4, 5, or 6, you do not want to use a TCA pill on them. So if they are a Fitz 4, a Fitzpatrick 5, a Fitzpatrick 6, TCA is not going to be for them, okay? TCA is great for your lower Fitzpatricks, your 1s, 2s, and 3s. It's great for aging, great for sun damage, okay? So with these two types of peels, pre-treatment is recommended. And when we say pre-treatment, I'm going to just give you guys a secret. Anytime you're pre-treating your clients for a peel, your pre-treatment is always going to involve some source of vitamin A or some lower level of an alpha hydroxy or beta hydroxy acid. And we want to pre-treat that skin to help get that skin sensitized and used to having acids introduced, and so that it is not as reactive when we do perform these services on your clients. As far as contraindications for your Jessner's and TCA peels, it's going to be the same as your alpha and beta hydroxy acids, okay? Um, During the client consultation, you just want to make sure that you are discussing any issues that your clients have, explain the procedures, explain the expected outcomes, um, Understand what they're going for. Are they trying to go for hydration, reducing pigmentation, etc.? Okay. Always follow your manufacturer's instructions, and that's pretty much it. Your clients after any peel, and especially your TCA and your Jessner's peels, your clients may have mild erythema, which means pink or reddened skin. That is completely normal. There also may be areas of frosting of the skin or an overall light frost, depending on the depth of your peel. And just so that you know, frosting just means that there has been some protein coagulation. Protein coagulation, okay? Frosting is due to protein coagulation. With more superficial Jessner's and TCA peels, the frost will appear as like a whitish, opaque haze, but you'll still see the pink or the redness below, okay? With medium or deeper peels, when more layers have been added, the frosting will become more pronounced. So make sure you watch your frosting. Um, and understand that sometimes it may look like an opaque haze. Other times it may actually look like crystallized frost on the skin. That should be both of those should be your indicators to stop. Those should be your endpoints, and you should not put any more layers. Okay, and you should watch your time. Um, Flaking and peeling will begin over those areas that move the most. So we talk with our forehead, our cheeks, and things like that. So those are going to be the areas where your clients are going to have more peeling. Okay, and then the intensity of your peeling and flaking will depend on the type of peel and the level of the peel that you've used. So it's important that you instruct your clients not to pick their peels, not to peel them off, not to pull any skin, because that can result in post-inflammatory hyperpigmentation or scarring. The last thing we have in terms of peels are designer peels, and I feel like I'm going to make this chapter, since it's so robust, I'm going to need to break this chapter up into chemical peels. So this will be one breakdown, and then the other video that I will post will break down all of the other advanced treatments in aesthetics. So what is a designer peel? So to yield more targeted results, additional ingredients may be added to various formulas, including things like pigment lighteners, acne ingredients, and moisturizers or hydrators. So a designer peel just means that there have been additional ingredients that have been added. Some key beneficial ingredients that may benefit your clients and their skin condition are as follows. For your clients that have mature or sensitive skin, it would be nice, or it would behoove you to find ingredients that work for them, or they may be added to your designer peels if you're going to use them, such as glycolic acid, lactic acid, any type of ceramides, hyaluronic acid, phospholipids, linoleic acid, aloe vera, allantoin, kojic acid, licorice root, or peptides. Okay, these are beneficial ingredients to combine with chemical exfoliation. These are going to give you higher yielded, more targeted results. For your clients that have hyperpigmentation, beneficial ingredients for them are going to be glycolic acid, kojic acid, licorice root, mulberry extract, bearberry extract, azelaic acid, and ascorbic acid, vitamin C. Okay. For your clients that have acne, beneficial ingredients for them are going to be glycolic acid, lactic acid, salicylic acid for sure, azelaic acid, and citric acid. Okay, so this is our breakdown on designer peels, chemical peels, beta hydroxy acids, alpha hydroxy acids, Jessner's and TCA peels. We talked a little bit about the pH scale, and we also discussed enzymes. So we will see you guys with part 2 of our video soon.